discussion, an in-depth conversation with the customers about the management of patient pathways. To make that conversation meaningful, our people will have to be fluent in the new NHS system. The second challenge is keeping up with the pace of change. On a straightforward level, this is about keeping abreast of changes to structures and to people. On a more complex level, it's about being quick to respond to opportunities and being able to turn joint working projects around quickly. I'm sure we've all been there where sign-off for some of these projects has taken forever. The final element is how we need to change to measure success. It's time to look beyond things like contact rates and look towards measuring the outputs of our interactions with things such as uptake of new medicines, number of successful joint working projects, and feedback from the NHS and other partners on the quality and the effectiveness of the work that we do together. Working in partnership isn't new. It's the journey that we've been on for several years. What the arrival of the new NHS means is that we now need to get to our destination quicker. We've covered a lot of things there in that speech, and I hope that it's given you some ideas and things to think about. So thank you for your time this morning, and I apologise again for Stephen not being able to be here today to talk to you directly, but it's been a pleasure to talk to you. Thank you.
So, a reformed ABPI, we do have some time for Q&A. There are still seats available down here if you want a seat, or you would prefer to stay up there. Please don't say that.
Hey, Gemma Shire from GSK. I was really interested in the example you gave about reducing kind of nosebleeding through some new initiatives. Now, my question is really about how do you diffuse that across all the networks to get them to engage, but how do you do that without promoting maybe one provider over another and still ensure fair competition?
It's a really good question. I think it's a difficult one to sometimes answer. But what we need to do is to make sure that we do have those conversations widely. And one of the things that is starting to come directly from the Commissioning Board and Department of Health is a real desire to see the good ideas that are out there being adopted and diffused widely across the NHS, without the NHS making a fuss about wanting to redo the whole process to say that we invented it here. That is a big barrier to that diffusion at the moment. And there's all sorts of reasons for it. What we've got to do is find the people who are prepared to be the vanguard, the cheerleaders for this stuff, and to support them as advocates to work alongside us to make that happen. It's going to take time. There's no point in trying to pretend that this is going to happen in 5 minutes. We are working and we're on a journey that we are working towards a destination that both the NHS and industry want to get to. And I think we've got to make sure that we work hard on finding the right tools and the right processes to make that happen. And I don't think anybody's got a definitive answer for it, to be honest. But if you find something that works, please let us know, because we'll share it with everybody.
Thank you.
Put your flat shoes on.
Andy Cowper from Health Policy Insight. The Health and Social Care Act, Andrew Lansley in particular, was a very big advocate of introducing value-based pricing on new medicines. Which is interesting because cutting the level of NHS management expenditure to 45% of that in 2008-9, and clearly value-based pricing will require significant management. Where is the ABPI's sense that the conversation about value-based pricing has ended up now that Mr. Lansley has gone?
I'm probably not in the best position to answer that question. However, what I do know is that there are a team of industry representatives working together with the ABPI, looking at the value-based pricing issue, and the negotiations will, I'm sure, continue. Where it'll end up, I don't know.
Somebody asked a question.
Just wondering, we've been talking about joint working for the past couple of years, and I was wondering how your new team will link up with other groups such as the Department of Health Joint Working Steering Group and CRIP Evidence website, etc.?
Now, in terms of the joint working team at the Department of Health, I'm working personally directly with them at the moment, and we're looking to build a common agenda to drive the joint working process forwards, both within the NHS and within industry. So you will hear more about that as we start to develop things. The whole thing went very quiet for around 12 to 18 months because people working on that project in the Department of Health got derailed to do other things. And it's now been brought back together, and the focus is back on it again, very, very big, is the best way of describing it. So there will be things starting to come out of that, which you will see.
Cabinet Fakers just delivered another 400-page tirade at the steps of the industry. Trust, honesty, transparency and all that kind of stuff. That's the mantra of partnership. What will be the ABPI's view, or have you taken a view yet, on the accusations in his new book?
The statement, I think, that was put in response to a letter to the Times, I think it was very much that he is talking about an industry from more than a decade ago. And that has changed significantly. Certainly in the UK, it's very different now. And that has been down to the way we've changed the code of practice and work to that and enforce it rigorously.
So he's wrong?
My personal view, yes.
Okay, well, maybe next year we'll get Ben along to say you're wrong. Do you have a question over here? I thought somebody would put their arm up. Okay.
I'll fire away with a question, Alan, if no one's coming from the audience. Can I pick up on the issue about the variation in uptake of nice practice and the ABPI view on that? Because I think it just contrasted very nicely with Amit's presentation earlier, who said, frankly, there is no more money. So once we've got past the beginning of the year, we've committed the funds, we don't have money. Clearly, NICE is producing guidance on a monthly basis, churning it out mid-year. How do you think commissioners respond to that? How can they release the resource, and what can industry do to actually help them implement the guidance?
I think it's a really good question. And first thing is, NICE guidance, once it has been issued, there is a legal requirement for the NHS to adopt it and implement it. And there's going to be a very interesting report, I think, that will be published reasonably soon, where all organisations in the NHS have been asked to provide evidence of their uptake of NICE approved medicines. And don't know what that's going to look like, but I think it'll be a really interesting picture. And I think where the industry has got to play a part here is working with the NHS, supporting them in a positive and sensitive way in adopting the new NICE approved medicines, and at the same time helping them to decommission stuff that can free up the headspace that was described by Amit to be able to fund it. The money's in the system, we've just got to find ways of releasing it. And I think that's the big challenge. It's something that we're starting to work around the edges with. I know numbers of companies are starting to help look at some of these things through pathway redesign, looking to take out elements of care that are no longer as cost effective or as efficient as they could be, and replacing it with things that can make a difference. And I think, again, it was described nicely when he was talking about the diabetic care. They spend more on it in the primary care arena, but overall the total expenditure is the same as their neighbours, but they do it in a different way, in a more expensive setting, which is quite interesting.
Okay, yes, question here. You've got a microphone. Thank you. Just tell us who you are and why you're not at work today.
Sue Priest from Grunenthal. I find it really interesting that you talk about NICE and the uptake of medicines, but we're also seeing it in the devolved countries as well. And we're seeing very positive recommendations from AWMSG and health boards not taking them up. And we're also seeing the same from SMC. And I know there's a lot of work being done by Rick Greville and the rest, and there's being very pointed questions being asked in various parliaments. But with this squeeze, I can only see it getting worse rather than getting better. And I wondered what your views were.
It is the challenge to us. And I go back to my previous answer in terms of how we can work with, support the NHS to help them adopt new stuff. Because when you get clinicians turning around to you and telling you that they're using the really newest modern medicines, which were actually first licensed 15 years ago, that concerns me. It should concern all of us because it means that they're not looking to adopt medicines that can help thousands of patients and actually help reduce costs overall if we do it right. But we've got to find the mechanism to make that happen. And I don't think we've got that right yet. There's a real challenge to us to make it work. So we need to find a way of making that happen. But we need to have dialogue as well with all of the people who are involved in the entirety of the healthcare system, from the people who do the commissioning of care to the delivery of care. And I don't necessarily think we've got that right either in some instances. It's a huge challenge to us because it is such a varied, gigantic organism, the NHS, that we interact with. And we interact with it on so many different levels as an industry. I've been working in pharmaceutical industry now for over 25 years. And I've experienced just about every different kind of customer at every different level in every country that we've got in the UK. And I can't even begin to pretend that I've got anywhere near getting it right a lot of the time. It is a huge challenge, but we must keep trying. We've got to keep pushing it. And it's why it's important for us to work together as an industry and to share knowledge on this stuff, to make sure that we can work it through and everybody benefit from it.
Kevin, Alan, can I just ask a very practical question about how you engage? Are you going out there looking for opportunities, then bringing in industry, or are you looking for industry to bring things to you? Is this your sales pitch today for these guys to come to you and say, we've had great experience in Aintree, how do we roll that out? What's the operational model?
What I was talking about in that speech that Stephen was going to deliver, the regional industry groups, they are made up of around 15 representatives from companies, and invites went out to every company who are members of the ABPI to nominate people to be sat on those regional industry groups. And we announced the week before last the names of the people who are going to sit on them. And they will start to meet on a fairly regular basis to look at the three things I outlined. I think that opportunities will be brought to the table by my team to discuss within those groups. And for the whole industry, we can expose it to the whole industry in terms of members of the ABPI to get involved in deciding who wants to play and who wants to work on those. I think that some of the companies will probably bring things to the table where they've got issues with moving it forward. Can we work together to make that happen? And in terms of the way my team operate, because there's only 4 of them, and you look at the sheer size of the change in England and the numbers of different organisations that are coming out, we've had to limit where they're going to focus their activity. And it's at the more strategic level. So they will be chasing down people who are going to be nominated to positions on the regional offices of the commissioning board, local area teams, academic health science networks, health and wellbeing boards, specialist commissioning groups, and clinical senates as a starting point. I'm quite sure that that will change over time and will expand. But we have to start somewhere. What we're trying to do is understand from a more strategic level in those regions, what are the big ticket items that the NHS is focusing on? What do they need help with? What can we bring to bear as an industry on those problems and help fix them together? So there's a lot of work around that. And at the same time, we'll be delivering industry messages that are key to us around things like formularies, innovation, health and wealth, medicines optimization. It just goes on and on. It just keeps growing. So the challenge is just being able to stay on top of it all, Paul, to be honest.
Okay, very quickly, one last question here. Then we need to break for coffee.
Comment, whatever that be. Kim Sargent from National Services for Health Improvement. You talk about the lack of nice or variation in nice implementation, but one of the interesting things for me is within all of these areas, there's winners and losers, and actually they're all part of your model. So that getting that cohesive behaviour to actually
I think it's a real challenge, and I think it's a good question. And I'm not sitting here pretending I've got the answers at the moment. But we've got to find a way through it. Because ultimately, there are winners and losers in everything, in every walk of life. And it's difficult sometimes to accept that. And I think as an industry body, we're there to represent all member companies. So therefore, we've got to try and find a way of equalising that out as best we can. But I can't pretend that I know the answers to all of that. It's going to be an interesting journey as we go forwards. But certainly, I think there will be more positives to it than we see on the downside. And the thing that's been impressive is through the work that myself and the team members have already got in place, going out to talk to the NHS, they are being incredibly positive in wanting to talk to us, which is, I think, a really good sign that they are starting to get the message about this whole issue of partnership and joint working and making it work effectively. And we need to build on that.
Okay, I think we need to break for coffee, so I'll let you go. Maestro at the back, if we could have some walkout music, please.